Time now for this week's Health Matters. Paul Critz with you, along with physician assistant Lynn Szabo. And Lynn was coughing just now, and I was waiting to hit record. And then it occurred to me that, no, we should have gotten that in there. It might have been.
You want me to cough again?
Yeah, could you cough again?
All right.
Oh, so why coughing so much, Lynn?
Because of the smoke. It's super awful.
It is, and it
It's
seems
really unhealthy.
And so just so listeners know, if you're not in the area, if you're in the area, you already know that. We've got a better than 60,000 square acre fire.
0% containment.
Well, because they're not working on containment. They're working on keeping structures from burning and the town of Gasky from burning down. So they're drawing circles around different things. I imagine they'll get to actually drawing circles around the fire itself. But in the meantime, it is burning maybe 15 miles away.
Yeah.
Maybe
the wind's blowing from that direction. Probably a little bit. There's not really any wind, so I think we're looking at an inversion layer.
Mm-hmm. Yeah, with the mix of the fog in here. Let's see, smog. Let's see, yesterday I was going fog and smoke mix. There's a term for that. What is it? Yeah, but it's just, wow. Yesterday was particularly bad. But then about 2 o'clock, as I said earlier, to about 2 o'clock in the afternoon, a little drift came up out of the northwest and kind of cleared it out, and we went out for a walk and got outside.
Right.
But
it's been a little awful in the mornings, a little bit better in the afternoons, probably because of the wind. Just for reference, the air quality measurement in Los Angeles right now is, according to my weather app, is 66, which is identified as moderate, and here is 216, very unhealthy. And actually, where I live over by Pebble Beach, it's more like 180. So it seems like it's. And this app is following me around. So I think they've got little pockets of stuff that's better and stuff that's worse.
You're a full mile closer to the ocean too, I think, than we are here. Maybe that has something to do with it. Just as far as air movement and such.
So it's really awful, super unhealthy. And right now we're in the unhealthy, and I've seen it as high as the hazardous range. So yesterday morning, inside the Del Norte Community Health Center clinic, it was 386.
Wow.
With an upper number of 500, which I'm surprised there's an upper number.
Upper number. What do you mean?
So the range is 0 to 500.
Oh, yeah. I see what I thought you said you were getting a reading of 500, but yeah, that's the scale.
So
right.
it's getting close to their upper limit of worseness, I guess. So
what are these apps? What are they measuring specifically?
I think it's particulate matter.
Right.
Yeah. So it seems to be worse in the morning. It has the last 3 days a little better in the afternoon, and it's likely to go on for, I think, 3 to 5 days, because it looks like we've got some wind in our future that could blow out the inversion layer and maybe blow it to somebody else. It's not like it disappears.
No. Yeah. I hear where it goes. It goes to Medford, and then my wife is talking with her father over there, and we're having a fine day, and we're going for walks, and we're outside, and he's like inside with a mask miserable. On, going, yeah.
Oh my God. So why is this bad? So we know by looking outside of our cars and looking at the smoke, and looking at what lands on our cars in the morning, that it's made up of particulate matter. So this is the focus of concern. But would not be surprised if a couple of structures had burned, or maybe propane tanks blew up, which happens in wildland fires. That this could be mixed with other toxins as well. But the focus is at particulate matter. So these particles are less than or equal to 2.5 micrometers, so super tiny.
That is super tiny. Wow.
And this is what blows me away. They get deep into the lungs, which I was kind of willing to understand, but then it crosses and gets into the bloodstream.
Well, is that size, whatever? I mean, I don't know how that barrier works between, air and blood in the lungs. How big are the holes? There has to be some sort of ability to transfer.
Apparently they're big enough that these particulates can cross into the bloodstream. So this increases risk for heart attack, stroke, worsening asthma, and irritating the airways. So a huge big deal. And I could see how that happens, because it kind of makes your blood thicker.
Yeah. Yeah.
Yeah. And so if you have a heart attack and you're trying to get oxygen to your heart muscle, if your blood is thicker and not filled up with oxygen, then, to its capacity, then you're going to start to have problems.
Sure.
So, and it can affect people hundreds of miles away from fires. So right now, I'm just curious, are you having your smoke alarms go off randomly? My smoke alarms in my house are going off. So it's either like some voice from the grave or something. But
It's a particularly helpful poltergeist.
yeah. So thanks, Mom. So what they actually measure is particulate matter in the air. Okay.
Wow.
So
wow.
that's what smoke is. And
Maybe
that's
I
what
need
smoke
to change the batteries.
Yeah, maybe it's time to look into that. So we always come to this question, and most applicable today, what's the average in order to do? So seriously consider wearing masks again. Mm-hmm. There's another good reason to do that. We're having a COVID uptick, and it's a variant of concern that's a little harder to build immunity against. Mm-hmm. So we got that going on too, but seriously consider wearing masks. And N95 or KN95s, that is NIOSH, and I got to tell you, I didn't look it up, has to be approved by them. But some of the KN95s have meet international standards, and it seems like that might be better. So just find a good quality mask. What I do is I haven't been able to figure all this out, so I just focus on getting a mask that's fit, and I get my masks from the clinics. So if you walk into the clinics and ask for masks, they'll hand them to you. No big deal.
So specifically, it has to be an N95. I mean, you're sort of run-of-the-mill
N95,
kind of.
yeah. I was wearing a regular surgical mask and still coughing, so it didn't do much.
And just as an aside, the NIOSH is the National Institute for Occupational Safety and Health. There you go.
Okay. So stay indoors with your doors and windows closed.
I never got that. I mean, I guess I think it's my house isn't airtight. How does that work?
Well, I think you're slowing it down a little bit.
Yeah, exactly.
But I was in the wellness center,
right?
Yeah, when it was at its worst, and we were all in fact, we wrapped clinic early because everybody was sick.
Wow.
So everybody was getting headaches. I was coughing. Mm-hmm. We all smelled like campfires. It was like it was exuding from everywhere.
So those big ass fans out front didn't help?
No, I guess not.
That's the actual brand name. My kids from the time they were like 4 and read that the first time, the big fans up in the lobby there, they just could not help but laugh at that every time. So that's a little aside for my children. I got to mention the big ass fans. So yeah, wow, inside there, the people were getting headaches and such. Man.
Right, and that's got a lot of techno groovy stuff,
right?
Built into it. Mm-hmm. So like lights go on when you go from one room to another, and then when you leave the room, they click off,
but they can't keep the smoke out.
Yeah, and there's computers everywhere. There's anyway. So the next thing you should do, first thing, stay indoors with doors and windows closed. Next, filter your indoor air. So they said if you have a you're going to have to help me with this. A regular heating.
Where am I looking at?
Not
here?
A heat pump. What's regular heating called? I don't have it in my home.
The heater. To me, it's a swamp cooler or heater. Is that what you're talking about? The water-based one?
Yeah.
Yeah.
So you can apparently put those on recirculate. So it's not the same as auto. You just turn it on and then recirculate the air. That's a way to keep just the indoor air recirculating and not bringing air from the outdoors.
Gotcha. Okay.
And then don't do things like light candles, vacuum, or use gas stoves, which, I don't know how some people have choices for that.
Right.
But I can skip vacuuming. That's not a problem.
I can't. I have an asthmatic cat. I need to vacuum every week.
You must vacuum.
Mm-hmm.
Huh.
Yes.
Well, maybe not today. So
I
don't like candles, but I don't know what you do if the power's out and that's the way you have light.
Well, I mean, is that the for like your run of the mill ordinary like wax candle, or is that I've also heard like the particulate matter things with your scented candles?
It's both, nasty. And scented are worse.
Okay, yeah. That's what I was wondering.
Yeah. So let's say you go down to you commit to mask wearing, and you get your mask from the community clinic. Make sure you have an N95 or a KN95. And so the way you can tell those is an N95, the rubber bands that go behind your head, that's an N95. Okay, does that make sense?
As opposed to what? What's the other option I have
a
here?
KN95, which has little loops that go behind your ears.
Gotcha. Okay.
Okay. So an N95, make sure you get them from a reputable source. For N95s, don't cross the straps, which I have a tendency to do. But one strap, the upper strap, if you have the mask on right side up, and I've seen some upside down masks. So the right side up, it's right side up because there's a little metal thing that goes over the bridge of your nose, and you can press that close. So that upper fastener goes behind the top of your skull, where if you were a woman and wearing a high pony, that would be. Okay? So you're looking at me like, yeah.
Yeah, that's helpful.
That makes sense.
The crown? Is that what you're talking about? Is it the crown right there?
Yeah, sure.
Right, isn't that the crown?
I would call it the occipital part of it.
Well, you would.
But not everybody knows that. I see your point. But also...
No, let's go with the ponytail. That makes much more sense. Thanks.
So, and then the bottom fastener should go where a low ponytail is, okay? So that's the occipital ridge. So that's that bony thing right at just above the nape of your neck. How about that? Okay.
Yeah.
So, but with a KN95, of course, they go behind both ears. Okay. So you fit the mask under the nose, over the nose, not under the nose, and under the chin. See, I'm not getting good oxygenation.
Yeah, exactly.
Totally clear. Don't wear a chin hammock. Obviously, that's pointless.
I can't even get into this. I mean, seriously, we're talking about wearing masks again and explaining how to wear masks again.
Pinch off the metal piece that fits the contour of the bridge of your nose, and then do a breath test. And I don't think anybody does this ever.
No,
But medical people sometimes do.
You taught me. I did.
Yeah.
I did with masks.
So once you think you've got it in place, you cup your hands in front of your face, like maybe an inch or two, and you blow out your mouth. Okay. And then if you feel any leaks, then you either address them or get a new mask.
Right.
Okay.
Right.
So other things that are helpful, air purifiers. I use one in my home, and there's lots of different types. We use them in the clinics, although I'm not sure they were super helpful yesterday, but mostly they're in the room. Best to run it on high. And then the coolest thing of the day is I found online instructions to make one out of a box fan. I don't even know if that's the right name, but a
those
fan
freestanding fans.
Freestanding fans. It's kind of enclosed in a metal cage, a porous metal cage, and you can actually do duct tape and stuff, and you can fasten filters to it and make your own air purifier.
I think this is exactly what they did on Apollo 13 in a much smaller version. I think that's exact. They had like a fan, and they had to they duct taped it all together so they could purify their own air in the thing. Wow.
Super cool.
All right, there you go.
So it's easy enough to find instructions for that online, so check it out.
And I'm sorry, what are you filtering the air through in this regard, in this case?
In this case?
Yeah, I'm looking through
There's a bunch of different kinds of filters. You can just look it up as to the specific one.
I'm just wondering, like, what's available and what,
I have a standalone separate air filter. I think that's important. I got mine at Walmart for about $30. I have a small house, and it's a small filter. I keep it in a central location. It actually helps me a lot. Like within 20 minutes, it's supposed to purify all the air in my, let's say, 850 square foot home within 10 minutes. And I think it's more like 20. And I noticed the difference from wheezing to breathing normally in about 20 minutes. So I think it's workable. My dad has a huge house, and he relies on the filter that's in his normal heating system, which I think he's impacted by salespeople, and I don't think it actually works as well because they got a lot of scented stuff in it. If they're filtering the air, they're still trying to kill their daughter.
Oh my God!
Yeah.
Oh, wow.
So we follow him around with a portable filter because he's elderly.
Oh my God.
Anyway.
Wow. So yeah, I don't know. And this was all, of course, all of this exacerbated. We're talking about filtering and things like that. That's something you can't do during a power outage. And we just went through, I think, what, 5-6 days of no power in Del Norte for most of Del Norte. So
yeah, but I don't remember the smoke as being as bad then. I don't think it ever got as bad.
Not like this. No, last couple of days it's been, yeah.
So you don't necessarily have to be running it when the smoke is normal. Right. So how would you figure out? Well, one, you could look out your window. That's a pretty good kind of rough estimate. Mm-hmm. But other is I look at my weather app and it has it there. Mm-hmm. So I've been watching it pretty closely. And like I said, mornings are terrible and afternoons are much better. But they're also an hour or two behind really bad.
What do you mean,
as you go through the flow of the day, mm-hmm. they don't update their stuff minute by minute. I think they get readings like every hour or two. Mm-hmm. So it seems to me the smoke looks worse than what they're saying. And then all of a sudden they report it as worse.
Right. It's got to trickle up the chain. I'm curious as to where the sensors are, how the network works, what it is that you're actually reading. I mean, you tell me that you get a different reading at your house from here, and I want to know, okay, fine, where's that reading coming from?
Right.
Because I don't know of any.
Right. I think it's probably associated with the airport, I would guess, or maybe one of the fire stations.
Yeah, sure. But so that's a third location.
Right.
So I'm not sure how that works.
I don't know.
But tell you. And I would tend, in my mind, I think that's like almost like, I'm suspect of that. I know that your phone isn't walking around sampling particulate matter in the air. And so I'm suspect as to the network that it's tying into, because I don't know of a network of air sampling stations in Del Norte County. Maybe one, maybe two. So what are the numbers you're getting? I think there's
one in the Birch Track.
Okay.
I think there's a weather station. I think they're associated with weather stations.
Oh, okay. So
if one
they're
at the airport.
I can look. No, they're weather stations then dotted all over. Yeah. No, that's true. Then maybe it just ties you into readings closest to you than when you move between those weather stations. Okay. Right. Okay, that makes sense.
Right.
Okay.
But right now, it's like orders of magnitude worse than LA.
Yeah.
Here.
Yeah.
It's super bummer.
Well,
so
I'm so tired of this. And this is so stupid. It's such a weird feeling to have, but just forest fires every year. This has been done. I'm tired of this.
Yeah,
can we find something else?
To burn,
we had snow this winter. That was neat. That was different. Can we do something different? This is just so tiresome.
Well, I don't know. The snow might get old,
Well, yeah, sure. That's fine.
My chickens were over in like 10 minutes.
Everything will get old.
Yeah.
This already is.
Right.
I'm tired of this. The one thing that is interesting is the parts of Del Norte that are on fire, and we don't have to talk about fire. This is health matters, but this gives me hope for the future, is that like the northwestern side of the fire as it is now, the Smith River Complex, is butting right up into what burned 20 years ago in the Biscuit Fire.
Yeah.
And so it's not taken off in that direction because that was burned through 20 years ago, and it's an entirely different forest now. So that's something that maybe then down the road we don't have to worry about the Smith River Complex burning.
That's
again.
my point. You run out of fuel.
Yeah.
And so what's the only fuel around? Houses, probably.
I was also thinking it might be because you were saying how sad it would be if it reached the redwoods. Well, yeah. First off, it would be really sad because it would have to burn through several pretty decent sized communities to get to the redwoods.
Right.
But then once it got to, I was thinking how poetic it would be if it hit the redwoods, couldn't make it through that mass, and the redwoods saved us. Because redwoods don't burn very easily, and they don't catch very quick, and they don't burn through. You don't get that often. So I was wondering about that. And also redwoods also exist where soil and air and everything changes. There's a real difference between coastal Del Norte and interior.
Yeah,
and
that's
so if
totally
the
true.
Fire came across the South Fork of the Smith, hit the back end of the few redwoods that are up there, it might be kind of a fire break for it. I can't see it.
Right.
Because redwoods just stay wet all the time.
You could have said that about the giant sequoias too, because they're supposed to be fire resistant, although a different microclimate. But they've suffered pretty heavy damage, and in the Santa Cruz Mountains.
Yeah, true. That's true.
They didn't hold the line, and they suffered. So, yeah.
I don't know. Yeah. It is. It's no fun. It's no fun to wake up and to see this and to see what looks like fog, and then you step out. For me, it's. So here's the thing. Here's a question for you. So my main line of defense are my eyes. If I step outside, my eyes start burning. It's a pretty good indicator. And I can get burning eyes and not smell things still. Yesterday it was both until the breeze came up in the afternoon. But that's not a good first like warning system, right? I mean, you're already particulates, particular particulates, as you painted the corner you painted yourself into in the email. The particular particulates, you're breathing those in even when you can't smell them, even when they're not burning your eyes, right?
Totally.
So it's unhealthy out there. Even
Totally.
Okay. Because that's what I go like. Oh, my eyes are burning.
Also, some people with lung disease might be used to crappy lungs, and
Right.
they might notice that. How much off from normal they are. And they might not be thinking clearly, like I alluded to. So that's kind of a problem. So my like warning light went off when I got a headache inside Del Norte Community Health Center, and everybody else all of a sudden started complaining of headaches.
Wow.
And I think at that point, now I'm in a data-free zone here, but I think that's kind of a sign of relative hypoxia,
Right.
when your brain isn't working well, and then it tells you it hurts. And one of the best medicines, we already know that one of the best medicines for headaches is oxygen. And so we went to a part of the clinic that didn't at least smell so bad, and within minutes people started to feel better.
Wow.
So I think there's little pockets even within large buildings and maybe within homes. Like I tend to do better in my living room than I do in my bedroom. And they're not that far apart. They're maybe 10 steps apart.
How did the fires, the smoke, the particulate matter, how does that interact with your asthma?
It makes it super hard to breathe, but in a way that I don't really realize it.
Okay, what's that? I guess, that's my question. What's that like?
It's very insidious. And so they've changed the way they deal with asthma, the kind of asthma I have. And so I read the journal, talked to my provider, got her to give me a different medication. So a mix of steroid and long-acting albuterol. First puff, 3 minutes later, oh my God.
What?
I was breathing so much better. And it was like a little scary because I didn't know how bad I was.
Wow.
So
Okay.
so the tidal volume of my breath was increased. All of a sudden I could feel all the chest wall pain when you're laboring to breathe, and the muscles in your chest wall are working too hard. And so all of a sudden they relaxed a little bit, and I could feel them complaining. But the depth of my breath was better. My headache went away. I could take a deep breath without having a reactive airway thing where you take a deep breath and then you cough as a response. And then so members of my pod all started to sit closer to me because they're all a little scared of me. I've been coughing for a long time, and they're not always completely convinced that it's
There were some,
be in an enclosed room with.
There were some COVID shows where the cough was very dramatic, I thought.
Totally.
Wow. To not even realize that your breathing had been impacted like that. That's insane.
I didn't even realize. But so that's interesting. Do you just accept a new normal? Because a lot of things in the body readjust to a pathological normal. And, there's a lot of receptors that get reset, and then you don't realize how bad it's going on. Or is it just your brain slowly turning all the lights out in the house and waving goodbye? So it's
we don't need to go in this room anymore.
Okay. Just go to sleep. So anybody out there with lung disease, and I would imagine this extends to COPD, is number one, there's new ways of treating it. Number two, this is affecting you, whether you kind of get it or not.
I guess that was my question about the burning eyes and the sensation is,
So headaches, if you're like starting to get like a dull headache, that's a super warning sign.
Okay, wow.
Yeah.
So before we move away from fire, just here in the last 5-6 minutes that we've got, I want to hit, or as we move away, rather, not before. I want to hit a little COVID update because you alluded to it earlier with this newest variant.
Right.
Have you seen it in Del Norte yet?
Oh yeah.
Really? Okay.
Yeah. Well, because remember the fair is a super spreader event. It has been, I think, 2 years ago with Delta, and last year a little bump up. This year, this variation of Omicron, and I think there's more than more than one variant of concern, but one dominant variant of concern. I think it's called ARIS, A-R-I-S. But don't quote me on that. I'm not entirely certain I'm remembering it correctly. However, it doesn't seem to recognize immunity conferred by either previous COVID episodes in an individual or by previous COVID immunization. So hopefully the newest vaccine booster that's going to be out, probably recommended to get in October, but if you're at high risk, talk to your provider about best recommendations. There's a couple of cool things about it. One is it's supposed to target this little group of merry pranksters. And the other thing is this particular variations or these variations of concern don't really put people in the hospital, but they do, people are still being hospitalized, but not in the ICU.
Okay.
So it's not as deadly as Delta was. We're still seeing people who don't even really recognize that they're sick, and people are shocked that, like, they tell me, is COVID really still a thing?
Wow.
So,
Yeah,
anyway.
no, it didn't. No, it's not that it went away. It's just that we're getting used to it. It's going to be here.
Well,
forever.
I think it's less virulent. I think it's more contagious, and
that's been the trajectory since,
Right.
all along, right?
And the thought is that almost everybody in the United States has had it, something like over 99% of people. Now, there's people out there saying, even as I speak, I never had it. Well,
You don't
could have had
to
an
necessarily-
asymptomatic case.
Yeah.
And
I've never knowingly had it, but I had
Right.
something that was weird, but didn't test
Right.
as COVID, but
Right.
it went on for a while.
Right. And so that brings up another question. I'm kind of wondering if with these latest variants of concern is the testing
Right.
as accurate, and especially a lot of people are testing on expired kits, which I don't in of itself think is a bad thing, but I just wonder if it's the most efficient way.
Right.
Because I've heard a lot of anecdotal reports of at-home kits being negative, but in the clinic where we have better testing, somebody's positive.
Oh, wow.
So,
Okay.
and you got to wear the mask. You got to isolate still, you guys. I mean, people coming into the clinic sick and they're like, what? COVID's a thing? I have
Do
to
you
wear a
know
mask?"
off the top of your head what the guidelines are still, or what they are now as far as if you're ill, how long you isolate, if you've been exposed, how long you should isolate, things like
I
that?
can only give you relative, but if you're ill, you should definitely be wearing a mask for 10 days when you're around other people.
Okay.
You should definitely isolate for 5. And they're saying at that point, if you test negative, then you can come back to work. But I think that's a capitalistic centric model. And I have seen it in action in the clinic, but I'm not sure that's the best medical advice.
Okay.
But I do have a hot medical tip.
Okay.
This is kind of exciting. And so try and remember what arm it was you got your last COVID booster in, and get this booster in the same arm, because it significantly increases your immunity response.
What?
Yeah, I know. What?
How the hell's that work?
So you know those little white cards that we were filling out and people were saving and stuff? It should say, it seems to me like I remember that I noted whether it was the right or left arm.
Wow.
I almost did left arms on everybody.
I remember when you did mine, it was a left arm.
It was
I
your
remember
left
that.
arm, yeah, because it was an owie one. You have some scar tissue, but anyway,
You just you reared back.
I
was just,
know.
what the hell?
Karma, dude. So, but try and remember which arm you got it on, and get it on the same arm, because that increases your immune response like by double.
Any idea why that witchcraft works like that?
No. Science is
Wow.
like, what? I think it's funny when they ask a question that seems like it's out of left field, and then they find an astounding response. So this is an example of that. I don't think they expected it to make a difference.
Right. That's what. Oh, right. Okay.
So check your white cards that you're carrying around in your wallet, or
Mine looks like it's papyrus.
Yeah.
Mine looks like it's from it should be a cuneiform. It's so old looking. Oh my God. It's like a clay tablet.
But see if the person noted what arm, because any good nurse would know what arm. And see,
I'm almost 100% sure everyone I've gotten has been in the left arm for some reason, because they would they don't want it to be sore. So they go, what's your non-dominant arm?
right.
Okay.
Yeah. So But there's also another theory. There's like 10% of nurses that want to put it in your dominant arm because you're moving it around and you're getting
so it'll
you're
work it
getting
in?
the
Okay.
antigen into the tissues.
Okay.
So you'll have to double check, but most likely it's on your left if you're right hand dominant.
Okay.
So
Wow, that's really weird.
That's super exciting. So October, it's coming.
Okay.
If you're at risk and you have like other comorbidities, you might want to talk to your provider about getting it earlier. But the problem is that that's going to, remember, there's like a run out date of this, and you don't want to get it too early and then have the big like Christmas to February slog be unprotected. So
Yeah, good point. It's your approach to the flu inoculation as well.
right, totally.
All right, we are out of time, Lynn. Thank you so very much. Boy, I hope we can talk about something else next week, about how clear the air is. That'd be nice.
How glad we live up here again.
This crazy rain we got.
Yeah, I know.
That'd be a wonderful
Go
conversation.
figure.
All right. Well, whatever the topic, I look forward to hearing it, and we'll see you next time, next week's Health Matters. Thanks, Lynn.
Thanks, bye.